Kate, that is your name. Kate Reilly. I'm a UUer from birth, and so it took me a long time to find you guys, but I'm glad I really have because it's
Glad to have you.
because we're few and far between, but it's nice to find like-minded people. Um, my story of being a caregiver involves my own self, which I have this bizarre gene in me, which I'm sure a number of you share, which is I need to be needed. I like when I can fulfill someone's needs. It makes me feel good. It is appropriate. I think we all should feel this. The world would be a better place if everybody needed to be needed. But that's another discussion. And then when I talk about caregiving, there are two types. There's the ones that someone's sick and you take care of them until they get better and you then move on. And that's sort of a, a temporary but intensive caregiving that you give to a child, you give to an ailing friend or a relative. And that is not really what I'm talking about right now. What I'm talking about right now is chronic illness that has no end in sight except death. And that's a really, really scary place to be for both the caregiver and the care recipient. And uh, I have a husband who has been sick for many, 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 many years, but he's been able to keep it at bay. He didn't go to doctors, didn't do this. About 2 years ago, he had a medical crisis and uh, was horribly debilitated, in and out of the hospital 5 times in 12 months. It's been a lot. It's been a lot. Some stents in his heart, complete denial on his part that he's really sick, and yet he can't get out of bed. His favorite phrase is, "I'm almost all better," he says from the bed. He still does this. Um, but he is, I'm lucky because he has gotten to the point where he can actually physically get up. And when we go to the doctor, I can do it without feeling like I'm torturing him, which is good. So my crisis is averting, but there was a time there when you would peek into his room 18 times a day to see if he was still breathing. And it's an undescribable feeling. And when my mother was dying, I took care of her. But with her, she was dying of old age, really. She was done and ready to go. And uh, she would say, "Oh, it's so horrible that you have to take care of me." And my phrase to her would be, "No, Mom, I get to take care of you. It's a very different thing." And it was, and she passed. And I'm really glad that I was there for all of that. And I have no regrets about any of that. My husband, on the other hand, it's a ongoing thing of which he is partially a creator of. And it's really hard because I want to slap him sometimes, but he's sick and I can't do anything about that. But during the time when he was in absolute crisis at home and the doctors all said, "Oh, go to that doctor," and you'd go to that doctor and they'd say, "No, no, go to that doctor." And then you'd go to that doctor and they'd say, "Oh, well, maybe you need to go to the one over there." And this went on for months, months and months and months. And still I couldn't do anything other than be there for him. And this made me a little bit crazy. I was not able to eat. I lost a good deal of weight. I was being sucked dry by this process. And so I sought help at the behavioral health unit of Wayne Memorial Hospital, which has a caregiver's component. And I went on the intake and she said, yes, you should be a part of the caregivers group sessions. But I'd also like you to see a psychiatrist. And I said, oh, okay. So I went to the psychiatrist and he said, oh, you're clinically depressed. I want you on Lexapro. And I said, and I walked away from the guy, did my research on Lexapro and went, no, I am not doing this. That is for, he called this clinical depression. This was situational depression. Completely different things. All Lexapro does is after it's built up in your system, you don't give a shit anymore. Excuse my language. You don't care anymore. And that isn't helping the situation. It doesn't help you help your recipient. It's just, it's nuts. It's madness. But I refused and gave my reasons for refusing, and then started going to the caregivers group therapy sessions, and that has been somewhat successful. I got to realize there are many of us out there, and I asked permission to tell the story of one of them, and she gave it at this thing. So I'm saying Irene is a woman in her late 60s, almost 70, and she has a grandson that she is the guardian of. And the grandson has muscular dystrophy. And muscular dystrophy is a terribly degenerative disease. It eats away your muscles and replaces it with lipids. So even if they could figure out how to regrow muscle, there's no muscle left to regrow. So they're working on trying to get muscles to regrow, but this kid will never. He's 15 and he's got a 70-degree scoliosis. And they're saying, and she related this to us in a session, and this means that within 5 years, his rib cage will be sitting on his pelvis, and he'll probably die at that point because of organ compression. Or you can get the spinal rods inserted on each of the vertebrae to bring him back up to a normal situation. Normal. He can use his hands and he can speak, but that's all he's got left right now. And she came home from the doctor, and the kid went online and said, I want the operation. With that operation, it is likely he could live another 15 years. So he doesn't have a long lifespan. But by the end of 15 years, this woman will be in her 90s. And she's the sole guardian. The mother was a drug addict and she disappeared, and the son just didn't know what to do with him. So she took over, and she's been taking care of him. And at that same session, the group leader said, have you ever heard of the Caregiver's Bill of Rights? And all of us in the room went, huh? Caregiver's Bill of Rights? What the heck is that? And he said, let me read these to you. And these are the Caregiver's Bill of Rights. And my hand is going to be Irene. This is her head. And it's 10 bullet points. I have the right to take care of myself. This is not an act of selfishness. It will give me the capability of taking better care of my relative. I have the right to seek help from others, even though my relatives may object. I recognize the limits of my own endurance and strength. I have the right to maintain facets of my own life that do not include the person I care for, just as I would if he or she were healthy. I know that I can do everything that I reasonably can for this person, and I have the right to do some things for myself. I have the right to get angry, be depressed, and express other difficult feelings occasionally. I have the right to reject any attempts by my relatives, either conscious or unconscious, to manipulate me through guilt and or depression. I have the right to receive consideration, affection, forgiveness, and acceptance from my loved one for what I do, as long as I offer these qualities in return. I have the right to take pride in what I'm accomplishing, to applaud the courage it has sometimes taken to meet the needs of my relative. I have the right to protect my individuality and my right to make a life for myself that will sustain me at the time when my relative no longer needs my help. I have the right to expect and demand that as new strides are made in finding resources to aid physically and mentally impaired persons in our country, similar strides will be made towards aiding and supporting caregivers. By the time this was over, her head was on the table, because there is nothing about this in our system that allows us any of these rights. These are aspirational, purely aspirational. This was written by the caregiverscalifornia.org. And it's a great idea, all of these, but there is nowhere in our world where, yes, you should have all these rights, but you don't get them. Yeah, it's an absurdity. Okay. And then you talk about the oxygen mask analogy, how you have to make sure that you put the oxygen mask on yourself when the plane is going down so you can take care of someone else. There's no room for that. You immediately have, it's a ridiculous idea, because the person who is right in front of you has needs that are so overwhelming that you can't provide for them. And all you do is tear yourself apart. And so you are losing not only the person who is needing care, you're losing the person who's giving the care. Irene will, under the current thing, never be able to go on a trip. She'll never be able to go out to lunch with friends on a regular basis. She'll never be able to follow a hobby that will take her into an artistic world of glory and joy. She will never have any of those things because our system doesn't allow for them. It just doesn't. And this is so radically wrong with what healthcare in America is. Now, I know traditionally back in another century, the youngest daughter always took care of this, and that was just simply their role. And it doesn't work in this current, our families aren't big enough to provide that, and it doesn't work in the current situation that we have. We need to create, and this is my little soapbox that I'm standing on, a situation where this doesn't happen, where people still get adequate care, and where caregivers are not destroyed by doing this. And people say, oh, AI will get robots to take care of people. And it's like, really? Really? I don't think so. Let's not insert another industry. We've already inserted the insurance industry into the healthcare thing. Let's insert an AI and really milk money off of everyone to go into the pockets of big medicine, big insurance, and big tech. But AI is here, and we're going to have lots and lots of people unemployed. And one person who needs round-the-clock care is the equivalent of 4 or 5 full-time jobs. We have to create an environment where that is the goal, to be able to have hands-on, humane, human touch contact with people needing care in a safe way, and have people who are trained to properly do this. I don't know how else to solve the problem, but to me, this, get rid of the insurance company, have single payer, okay, politics, sorry, and the money that you're paying for all those administrative people to say, no, denied, 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 put those people to work doing the work of caregiving, because we have so many people that need it. So many people that need it. There are systems. When I tried to find care for my husband. My husband is not qualified for Medicare because he's too young. We don't qualify for Medicaid because we're too rich. We have more than $4,000 worth of assets, and you have to be under $4,000 worth of assets to qualify for Medicaid. So I went to the Council on Aging. Council on Aging says, oh, he's over 60? Yes, I can help you. She started calling around and gave me a call. This was the nurse. And she called me back and said, all the agencies that I met with say they already talked to you. I said, yeah, I'd done my research pretty carefully. So, and she said, I'll send you a list of private agencies that you can hire. I said, okay, send me the list. The list had was a whole page. 2 agencies covered Wayne County. One was for live-in care only, and we don't need live-in care. And the other one never returned my phone calls. What? I have money. I want you paid. I want you to have some help come in. No can do. It was a nightmare. So, I don't know. I ask people to tell me your story and tell me, do you have any other solutions? Because we need to solve this problem. It's a big problem. Anybody? Anything? You lived through it, Steve.
Yeah.
Did you get help anywhere?
And the only help I got was from relatives and neighbors.
Yeah, neighbors are great.
Yeah.
What part of it knows?
That's what I was saying. I went to the process. I can afford it, but I can't find it. That's the thing. They don't. And I started talking or asking around. Anybody know nurses in the area? I'll hire them privately. And no one, they're all,
The closest thing is hospice. The concept of hospice.
but in hospice, you have to say that you're going to be dead in 6 months. And nobody said that. So I thought, let's go to palliative care. Palliative care, great. We don't accept cash in any form. Only accept insurance or Medicare or Medicaid. And our insurance company does, and I have a gold plan for him because I knew this was coming that has out-of-network coverage. No, we don't do that as out-of-network coverage. It was crazy. Hey, Jill.
I just, with my parents, they belong to St. Paul's Church, and I got help through their church, from members that came in and when I was working, because my father, was my mother's Alzheimer's, he couldn't take care of her anymore, et cetera, et cetera. And I was working for Laura at the paper at that time, and so, there was that's where I got my help.
Yeah,
But it wasn't specialized at all, but they were there, always there, and if there was an emergency, I was just down the street, so.
Yeah. Yes, sir.
Thank you for reading those 10 points.
Scary, aren't they?
Yeah, they're, and it isn't that I'm expecting someone to say, yes, we're going to do that. Everyone needs a caregiver, has to demand that. And I realize I hate being a caregiver. I hate it. I don't like doing it. The person I'm caring with is ungrateful and makes my work difficult every step of the way. But I realize that I think that's it. That would be the
Yes.
there. I finally found, first through Cornell Cooperative Extension, they have a very timid caregiver program run by a person who's not trained to do it. It turned out that there was a session once a month at night, and there were 2 of us. And when the other person's husband died, there was me. And how can that be helped? It would be in a caregiver group of 1 person or 2. But they hooked me up with the caregivers Zoom every week out of Office for the Aging and Extension of Orange County. And I do that every week. Somehow they let Sullivan people go. The woman is trained, and people of great disparity in terms of economic background and racial profiling. But when I hear them talk, I think, oh my God, you have an easy time. I mean, I have it, and compared to what other people are facing, I have it pretty easy. I try, and then people give each other, they say what they're doing, you know. If one tries to reason with the person you're friends with, it doesn't usually work. And finally, I've stopped doing it. What I think is a problem, and is that the rationality of the way to go seems to me clear. There's no, I don't do that anymore. When it gets really bad, I leave the room. I say nothing and I just walk out. I just walk out because I can't discuss this. There's nothing to kind of.
Yeah, that
Other thing-
technique is called gray rocking. And
I think for me it works.
it does work. It does work. It helps to preserve you.
The other thing too is thinking about what kind of end to my life I want to have. So I'm grateful that our governor has signed this bill that I can sign up to take a pill when I'm close to death. And I think that's really important. New York State's moving in that direction.
That's what they have it
I
in
know
Jersey.
2 people who have done that more than once with brothers, husbands, and mother. Sometimes the idea of keeping a man with rods up for another 15 years. So this woman will be 95 and still, what's wrong with that picture? Sometimes isn't,
But he has to want it.
well, yeah.
That's the thing. And he-
How much do you give of your life? Yeah, that, you have to value yourself somewhat.
Yes.
That's what it's.
My father supported organized to die for years and years and years and years because he was so ready to go for so long. Well, he couldn't have the life he wanted. He didn't want to be here.
Well, my mother was in a facility and I would visit her I would be with her all the time. And she would just say, can't they just give me something? And that would be her refrain. And I remember it was in March, early March, and I have a friend who shares my birthday. He said to me, what do you want for your birthday? It's in April. And I, without missing a beat, I said, I would like my mother to die. And he was shocked. And I said, no, she wants to die. I want her to have her wish. And, and she did, which was okay. But it was because we finally got her into hospice and they were able to snow her with the morphine, which is the.
I was with Dorothea.
I was with Dorothea,
You were.
and I saw her in the hospital when she was in the hospital. 97, she was in 97, where she had lived in her life, right? Then I went to see her when she finally got into the nursing home in Sweden. And she was sitting there saying, if she could breathe and could say anything, wanted to die. It was like she wanted this. And they were trying to get her hospice there in this nursing home program, which they didn't do for everybody. This was like a special thing. And she was grasping the breath with the oxygen and everything. And I'm looking at it and I'm thinking, you know, I thought she was suffering. I felt, and this nurse came in and sat down and said, she's not suffering. She goes through this whole elaborate thing about whatever, with her vessels and the way the color of her organs and well, the next day, they got her into the hospice program, and the next day, she died. Thank God. What? What? This is a woman who lived through what she lived through, 97. It's her choice.
Is the Hemlock Society that place where they can tell you how to gather medicine so you
Probably. I don't know enough about the Hemlock Society.
surely there is a way that, and I have thankfully that some people I know well have somehow assisted in passing of their loved ones. Well, my mother said this, I'm passing through, I want to go home.
Steve?
My father, he was in hospice, he said, no, nothing worse than not knowing the only time left, that they became, they could go on the faster. Yeah.
Yeah.
So that's all for time he's dead. But, they gave him that, morphine with those painkillers, for the time. They're doing, so, this is a good time to go on off, so you know the doses. But, and like he said, he was adamant. He said, he felt that he had reached this point. He wanted to go, but he said, what there was. It's like, I even suggested, maybe see if he needs some marijuana for him because he entertained, like if they didn't know anything would be killed in the autopsy. Well, he had read the thoughts into human, but only got to miss him that. But they.
Yeah.
Said he wanted it in Nevada, they would have told very strict laws about it.
I have posited to the leader of the group that we develop a template letter that we could reproduce and give it to everyone we know, send it to caregivers or organizations across the country saying, to send to politicians saying that this is a problem that needs to be addressed.
Sure.
Because the only way politicians actually do anything is if they hear enough through the proper channels, and you got to know whether if it's state and local, that's a letter. If it's federal, it's a phone call about what your concerns are as a constituent. And right now, there's no groundswell of this, and is it possible to create that groundswell? Because it needs to be addressed on a systemic level, not just on a, well, Aunt Tilly needs help. Does she have a neighbor that come in? Yeah. It's a bigger problem. And it's only going to get worse because as we age as a population, there are fewer young people because that's the way the demographic is. And as Lori was saying, we're losing all the caregivers because we're shipping them back to their home countries.
Yeah.
Oh my good, it's, the ramifications of all this moral conundrum are
I
huge.
think she's done.
Sharon wanted to say something. Oh, she doesn't have to. Not first, Sharon's not.
I just, thinking about the Bill of Rights that you read and the comments that you made about we don't really have those rights. I think in the nature of rights, we do have anything we do right. The document says that they are endowed by their creator with certain unalienable rights.
Mm.
Those rights can be restricted, can be trampled, but we can be harmed by other people who take those rights from us, or they don't take the rights, but they impair our exercise of those rights. I think that's important to keep in mind, both systemically and at an individual level. We still have those rights.
Can I just say something? One of our members, Laurel Mason, is a nurse. I think she's a hospice nurse. She may be a palliative care nurse as well. Her telephone number would be on our membership list and everything. She lives in Maryland. She may be useful for information, especially if you're going to be writing something up. She might already know what's.
That's why I'm going to the leader of the group because
Yeah.
they have.
Because she's a very caring person, and she does. I think she is, of course, still working. And that's why she doesn't come to services very often. But you might want to call her and chat with her because she knows a lot and she's been doing it for quite some time. The other thing I wanted to ask is, I know that you said you have the means to pay somebody, but after a while, that's going to run into a lot of money. It's not just, that's for the billionaires. That's not for middle-class people. So I know that if you can qualify for a caregiver, there's money. And then of course, if you could find someone, at least some of that money could be given as salary to somebody, if you could find somebody that's reliable and everything. I was just wondering about how to go about getting on the list to being a caregiver so that you could get financial aid from the government.
Most of the people that receive money for taking care of their kids, because this is, caregivers do qualify. You have to be below a certain threshold of income in order to qualify to be paid. And I'm already doing the work, so
I know.
yeah.
But the
no,
fact of the matter is something should be done there, because no matter how much money you may have, I mean, most of the people who are caregivers are on Social Security and whatever their pension is, that we're able to sustain ourselves. But if we're called on to then pay someone else to come in, that could be a whole other ballpark. And I think that's a very valid thing to consider, because there's a finite amount of money that's going to
There's
be
something
available.
called respite care, right? But few and far between and hard to get.
It's only temporary. It's not permanent, it's not, there's a certain time limit on it.
Yeah, but even qualifying for it is
Yeah.
really hard to do.
Well, Medicare goes.
Yes, but he doesn't qualify for Medicare. Yeah, so I qualify for Medicare, but he doesn't, and he's the one.
Then it
Upon-
falls on your income.
There
Right.
should be some other category
I have a
that comes into
suggestion.
play.
I have a suggestion. With my experience, when I cared for my stepmom through her hospice experience, the insurance company, apparently they had an insurance plan that would cover some help. And I was like, when my dad, after she died, told me about it, I was like, I don't want to be paid. I was in a situation where I didn't need it, so maybe check with the insurance company about that. They will not tell you, you have to ask. But then there's also, I had several friends, whose family member or partner, and they were taking care of them, and Social Security paid them to take care of them. And I don't remember the name of the program, but it doesn't pay a lot, but you're getting compensated for some of that work, and it helps because you're in the home. It's not like you can go out of the home and get a job and leave this person alone. And it really was an amazing help to them. Like in some cases, an aunt or a niece or a nephew, but in other cases was the partner. And I was friends with all these people. It's a real thing. Now I know a lot of changes has happened with Social Security, but check with that because you may qualify for that. That sounds really like it might be able to cover what you're dealing with. But I also wanted to say something about the Bill of Rights for caregivers. It sounds like that comes from maybe 12-step Bill of Rights, right? Somebody kind of tweaked it, and it's mostly at least in the 12-step, it's personal rights. It's like you take power in your life and you claim those rights. Like you don't need to say it out loud or anything, but you just put them into place in your own life. And it can be rather daunting. And I know I learned of those Bill of Rights when I was caring for my stepmom, and it meant a lot to me. And I also had a support group, and the support group really helped me keep those in my heart and do what I could to take care of myself. And yeah, so I don't think I mean, just another way of looking at it, there's no systems that will support us, period. I think systems are inhumane. They don't have humans in them. We have to do it for ourselves and for each other. And I think that I love that Sharon shared that about the nurse, because that contact, she might, I mean, we live in a small world. She might know someone near you
I think.
who could help you too. It's person to person. These systems are computer based and money based. They don't care about people, you know? So I also want to send you love with what you're dealing with. Want to send you love and support too. So
Fortunately, he
thank you
seems
so
to
much.
have turned a corner so that he is much more able to be in the world, and I don't need to be at his side the entire time.
Well, I'm still sending you love and support. I'm one of the people who take care of the family members, and my grandmother was the other one in my family, and so I understand what you're going through. And I just want to send you love and support, and thank you for sharing today. It
Well,
was very
thank you all for listening, and it's such a group problem. It's not just mine. I know that. We all are facing it. We have to deal with it. It just has to be done somehow.
Thank you.
true.
So thank you, Kate. The power of personal story cannot ever be underestimated, right? And one of the things that I've been trying to do is when people ask me how I am, it's my little thing. I do not say fine. I don't. Well, it kind of depends on who it is. You know, I'm tired. I feel overwhelmed. If I know them well, like I was at a Chamber of Commerce breakfast, and she's like, how are you doing? How's the paper doing? I'm like, I'm struggling. I'm struggling. Do you know what I mean? And it's very interesting because just saying that, I mean, you don't have to go into like a bunch of details, but you know, it's kind of like that is, it's like you're opening the door, you know, to kind of actually be there with that person as opposed to kind of going, oh, I'm fine. Like, how could you be fine? How could anybody be fine in this world? You know, who has any kind of conscience? I mean, it's like, you can't. You know, to that end, I do need to just give you something that I forgot before, is that there's an article online for the River Report on the River Reporter, and right this instant, there's an amendment to the Water Development Act, Transportation and Water Development Act, which will strip the DRBC, the the Delaware River Basin Commission, the Susquehanna River Basin Commission, the Potomac River Basin Commission of regulation on fracking.
Oh, God.
And so this is, and what they've done this time, there's a guy in Pennsylvania, Scott Perry, who's been bringing it up. It's not like new. They've been trying to brings it up every year, I think since 2023. But this time they just kind of threw in an amendment, right, that nobody's really talking about. And it's a very bipartisan thing that people vote for. So unless you actually know that amendment is in there, you won't vote against it because it's not, you know, unless you were to read the whole thing and understand that something got put in. Anyway, there are people in that committee that need, as you said, a phone call today. And you can go online for the thing. Also, there's been some stuff on the Beauty Network about it as well. So Kate Reilly is one of those. They don't necessarily have all the votes, but they really do need the phone calls. So, at any rate, you know, it's not really the same, but this caregiver, you know, there's this very, very personal kind of story, but then there's this other kind of emotional kind of story about how would it be that we have to caretake, you know, like all of the things that are going on right now. Do you know what I mean? And I'm saying personal story and doing what we can you know, and often that is absolutely taken care of, you know, mental health, for sure. Anyway, I have one more chant, and then we'll blow out the candle, chalice. We're here to find meaning in the darkness, here to find meaning in the light, meaning in the darkness, meaning in the light. We are here together. We are here to find meaning in the darkness, meaning in the light. We are here to find meaning in the light. Let's do that again. We are here to find meaning in the darkness, meaning in the light. We are here to find meaning in the light, meaning in the darkness. Meaning in the darkness, meaning in the light. Meaning in the light, one more time. Meaning in the darkness, meaning in the light. Meaning in the light. Are here together, together. We are here together. One more time. We are here to find meaning in the darkness. We are here to find meaning in the night, meaning in the darkness. Meaning in the darkness, meaning in your life one time. Meaning in the darkness, meaning in the light. We are here together. We are here together. So we'll extinguish our chalice. We will keep in our minds all of our ministrations to those who need and to ourselves as well. We are thankful until we are together again.
You're welcome.
Can you send those around that I can somehow?
Sure, I suppose. Can I take a picture and send it to you, Tom, and you can.
Thank you all.
Thank you. Have a wonderful week. See you again.
Yes, thank you. Yeah, I want to hear an update on how she's doing as well, Sheila.
I
I've
know,
been
we
missing
haven't seen
her,
her
and I
forever.